In Fox 5 Health News, cannabis poisonings among seniors in Canada have tripled. A new study finds many older adults are not aware of the potency of today's weed.
All right, joining us now, Dr. Serge Sucker, Chief of Infectious Diseases at Holy Name. All right, Doctor, this is an interesting study. Walk us through exactly what we found, because as we mentioned before, the weed of today is so much stronger than what it was even 20 or 30 years ago.
Yeah, hi, Steve and Tasha. Thanks for having me. So it's no surprise that recreational cannabis use has increased as it's been legalized throughout many areas. What may be surprising, however, is that the group that's actually increased the fastest is seniors, those 65 and over. And with the study in Canada, they actually looked at a registry of ER visits in Ontario over many years, found that all groups, all age groups, had increased visits to the ER for cannabis overdose. But the group that had the highest increase was indeed seniors. So as Natasha alluded to earlier, this is not the weed of the 60s and 70s. What are some of the quick differences? Most people consume now via edibles, whether it's a gummy, candy, brownie, muffin, even a beverage. And the way the body metabolizes that is very different than how someone may have done it back in the 60s and 70s, i.e. inhale via smoking. When you have an edible, it works slower. So sometimes people take a dose. They say, well, hey, there's no effect. Let me take another one. And then they get more than they're bargained for. Also, the way the liver metabolizes an edible is very different than when you inhale it. It can be more hallucinogenic, and so you see people coming to the ER with hallucinations. They can come in with tachycardia, fast heart rate, or even cyclic vomiting. So people really need to understand that it is much more potent. Edibles are processed by the body differently than maybe someone had used marijuana in a previous time.
Yeah, dosage is key for sure. All right, well, drowning deaths in the U.S. have increased after years of decline. A new CDC report finds many people lack the skills they need to stay safe in the water. Doctor, walk us through it.
Yeah, and this is actually somewhat shocking. CDC reports 15%, that equates to 40 million Americans admit they don't know how to swim. And the numbers are actually shocking. Over the last many years, that equates to about 4,000 Americans dying every year from accidental drownings. And as bad as that has actually increased since 2020, another 10%. So maybe an extra 500 or 600 people on top of that are experiencing accidental drownings and tragically passing away. And so, of course, what is the cause? And as many things, what we're looking at is the pandemic, 2020, where we're seeing increases across the board, but particularly in two major groups. One is in toddlers and preschool age children, and two would be in African Americans, where we're seeing the increase out of proportion from our other ethnicities or other age groups. And there's no real reason definitively that has been delineated, but what has been looked at as association, of course, is COVID-19. During COVID-19, less public pools, staffing issues, less swim instructors, and less accessibility for people. And unfortunately, that's correlated to increasing deaths downstream. So I think it's important for all our listeners out there, with summer coming, Memorial Day around the corner, for everyone to really kind of re-evaluate their skill sets for swimming in the pool, swimming in the ocean. And remember, it's never too late. Even adults, it's never too late to learn how to swim.
Yep, a good reminder there. Doctor, thank you so much for joining us.
Thanks for having me, guys.